Telemedicine is becoming a more common alternative for doctors to treat patients, and that continues to be the case, especially during the coronavirus pandemic. Here to discuss the rising trend is physician and professor Dr. Dan O'Brien. Thank you so much for joining us.
Thanks for having me, Stephanie.
What are some of the benefits of telemedicine compared to a traditional doctor visit?
Right, it's actually keeping patients out of the ER as well as clinics if they don't have to be. So we're not seeing an overcrowding of those areas. And also, too, looking at patients that are coming from rural areas, they're able to have the access to care that maybe they never had before is really important. And thirdly, looking at the cost. Obviously, we're seeing a rise in cost for unnecessary visits in ERs and clinics, and this telemedicine is actually helping to decrease the cost. So telemedicine actually is making a positive contribution during this digital health transformation that we're seeing because of COVID.
And I think right now, if someone is sick, the last place they would actually want to go to is maybe a doctor's office or hospital because of COVID-19. Now, more hospitals are implementing stricter measures in light of the coronavirus pandemic by not allowing visitors and urging family members of patients to not even enter waiting rooms. Could a technology like telemedicine prevent the future spread of the novel coronavirus or something similar to that?
Exactly, Stephanie. What we've seen in regards to a published study from Harvard was it actually is kind of preventing the spread of the disease. Obviously, it's keeping people, staying at home, quarantined at home, as well as even physicians as well, that if they become ill, they can actually communicate virtually as well.
Well, what would you say to patients who may be skeptical to go that route because of potential hackers?
Sure. I really think right now there's a great deal of cybersecurity, and I think that IT departments within hospitals and health systems are really staying on it. So I think we're going to see a decrease in that. So I think just be mindful and continue education of IT staff workers and just looking at the importance of cybersecurity during this time.
And there are limitations to telemedicine with regards to high-risk patients, but you say that telemedicine is evolving each day. How so?
Exactly. There's still many things that we don't know. So we're just learning so much every day, especially with even digital apps that are coming out and how we can kind of better communicate virtually with patients. So certainly an exciting time for telemedicine.
Interesting, especially right now, of course, with this whole coronavirus pandemic that's going on, and we are seeing the rise in telemedicine. Thank you so much, Dr. Dan O'Brien, for giving your input and take on all this.
Yes. Thanks, Stephanie.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.